headquartered in Australia, and we are here to help the healthcare professionals from across the domains available for the health industry. We provide courses that will help you to ace in the licensing examination across the globe. Having said that, on screen we have our CEO, founder, Dr. Akram. He himself is helping the healthcare professionals in terms of migrating to different countries, as well as achieving the career dream that people are looking for over the past 10+ years. Sir is helping healthcare professionals. Now, on the screen we have the academic heads. We have Dr. Alok. He is our academic head for the for pharmacy courses, as well as we have Dr. Rini. She is maintaining the helping the medical courses. Now, this is the faculty who are helping us with the OPRA preparation, and they all have qualified the earlier version, which is CAPS, and they have gone through the similar set of journey, and they are well equipped at bringing the best for all in terms of acing the OPRA examination. Now, about the OPRA examination, this is the Overseas Pharmacy Readiness Assessment, and OPRA is now being replaced with the earlier version of CAPS, and from this year 2025 March, OPRA will be take place, and it is mainly used to ensure that Australian Pharmacy Council, what they do, they assess the competence of the overseas qualified pharmacists who are planning to migrate to Australia and work there as a registered pharmacist. Now, what is the eligibility criteria? Bachelor of Pharmacy or the higher degree is the minimum requirement, and you should be having a registered licensing in your home country. If you are having these two documents, you are eligible to sit for the examination. Now, what are the steps that you have to ensure while you are planning for taking the OPRA examination? You have to start with the initial skill assessment. Now, what is that? The APC, or the Australian Pharmacy Council, they will be assessing all your documents like your degree, your mark sheets, your PCI or the Pharmacy Council licensing in your home country. So all these documents will be validated, and then you will be given the opportunity to sit for the examination. Now, the third step is the English proficiency test. Now, this English proficiency test you can plan alongside your OPRA preparation, or maybe before that, or maybe after that. But all these examination will have their own yearly validity. So your OPRA examination is valid for 3 years, and your English proficiency test, that is valid for 2 years. So what people used to do, they used to first complete the CAPS. Earlier we used to call it CAPS, now the OPRA examination. Now after that, people will be going ahead with the English proficiency test, followed by the job and the visa preparation. Now, these are the basic details for the OPRA examination that one should be having in mind. So we have pointed out the exam centers, which is only specific to India at this point in time on screen, as you can see. Apart from that, across all the cities, you will be getting at least one center for the examination. Now, the OPRA examination is being conducted throughout the year, and this year the March series will be done from 3rd of March to 5th of March, followed by the July series, which is from 14th of July to 16th of July, and the November series, which is from 24th to 26th of November. Okay. Now, about the examination pattern, what you can expect. So earlier it was 2 papers, but now with the OPRA coming into picture, you will get only 1 paper, 120 questions it will be having, and you have to complete the paper within 2.5 hours. I will be discussing about the other details of the examination in a while. Now, the content area, that has also got changed a bit. If you have seen the CAPS preparation or the CAPS content area, now for OPRA, they have introduced the biomedical sciences as well as the therapeutics and patient care, which is holding the majority of the weightage, right? Apart from that, we will still have the medicinal chemistry, followed by biopharmaceutics, pharmacokinetics and pharmacodynetics, and pharmacology and toxicology. But this biomedical sciences and the therapeutics and patient care, wherein you can expect questions on the clinical or the clinical based questions. So that is about it. Also, the exam scoring mechanism. Earlier, it was a very straightforward scoring. Every question used to have a similar set of scoring attached to it. Now, given this rash methodology for the OPRA examination, which got introduced, so here all your questions will be bifurcated at a difficulty level. You will start with the easy sort of question. If you clear all the easy level of question, you will be moved to the next stage, which is the medium one, wherein your scoring will be a bit higher than the easier questions scoring. So that's how they will be assessing your performance, and it is not like that there is a set benchmark of the scoring. So whosoever will be appearing based on the entire learners or the aspirant set, they will be just checking who all are meeting the target. That means who all are giving you the right amount of answers. So that's how the scoring or the passing criteria will be decided. Now this is the fee structure. So when, as I was mentioning, right, when you will be starting, you will be going ahead with the initial skill assessment. So for that, 810 AUD is the charges that should be paid to the APC Council in order to validate all your documents. Your examination fees, that will be at 2,190. This should be paid while you're putting your examination. And for the English proficiency test, PT, IELTS or OET, out of these three, you can select any one of it. We always suggest that go ahead with the PTA because of its easiness. So in that case, it will be 300 to 400 AUD. And earlier, if you compare it with CAPS, the examination cost was a bit higher. It has been reduced by 100 AUD. Now, what are the documents that are required for the skill assessment? One is your degree. The second one is transcript. That means the consolidated mark sheet. Okay, your birth certificate, your valid passport, any government ID proof, Aadhaar card is preferable, and your passport size photograph and your pharmacy registration certificate. So these are the mandatory checklists that you should be having in hand when you are sitting for your initial or when you are preparing for your initial skill assessment. Now coming to the English proficiency test, you get 3 options to choose from. And for every category, you should be going ahead with the academic version of it. Okay. If you are going ahead with IELTS, then the minimum band score should be 7. If it is PT, a minimum score of 65 should be there. And if it is OET, you should be having a grade B, or maybe you have to have the score of 350 out of 500. Now, these are the type of visa that one person is eligible when you are clearing with your OPRA as well as your English proficiency test. If we go ahead with the PR type of visa, subclass 191 and 190. These are the 2 subclass that you are eligible for, and here you do not require any work experience while filing it. If you are going ahead with the work type visa, there you will be eligible for 407, 482 and 404. Right, now in terms of 482, earlier it was meant for 2 years work experience. Now from the last year November, that has reduced to 1 year experience. Okay, and 494 will still have 2 years of experience required. Also the study type of visa, here you can join any master degree course or maybe a PhD course. Followed by that, you have to complete your internship together. At least you have to work 24 hours a week, followed by 1,575 hours should be completed for your internship. Then only you will be eligible for the next step. However, it is always suggested that even if you are preparing from your home country at this point in time, at least be associated with some pharmacy, some organization which is nearby to your place, and keep working, because this work experience will add on value while you are filing for your visa. Also, in some of these states, they are looking for experienced candidates. So obviously, if you are having experience, your profile or the candidature will hold more value. Now, this is a basic, difference between the OPRA versus CAPS. Examination pattern, for CAPS, it was 4 hours, 2 papers, wherein for OPRA, it is 2.5 hours, 1 paper. And for CAPS, it was like 200 question, 100 question each paper. Now it is 120 question. So this is the very basic difference between both the exam pattern. Now, what has changed with OPRA? Obviously, the exam duration got shorter. We will be more focused on the therapeutics and the application knowledge of it. Exam cost also got reduced with 100 AOD and the updated scoring methodology. And what has not changed in terms of the difficulty of the examination, there is no change. Only the pattern of the examination, you can expect question in multiple levels. Okay. Also, the eligibility process, registration process will still remain same. You will be visiting the examination hall in terms of delivering your examination or taking up the examination, and no changes in terms of the number of attempts. There is no change on that, or the validity period of the result, which is remaining 3 years. Also, there is no negative marking for the examination. Now, why to choose Australia? The number of PR visa offers that Australia is currently offering, it is one of the lucrative option. The job vacancies, the career growth, as well as the salary package. Obviously, when you are migrating from your home country to a different country, this is something that we all should look for. One is our career progress as well as the salary package. So the numbers are on the screen. These are done from the latest research that we could collect. So yeah, that is about it. Apart from that, obviously, as I was mentioning, that the number of jobs, the latest research, what it is applicable of the internet. So we have curated those data. Now, apart from that, what are the benefits? Obviously, higher earning potential, the quality of life, career opportunity, work-life balance, your professional development. Maybe you are going there as an intern pharmacist, but the career progress that you can build over there as compared to different countries, that is much on the larger side. And the free education and the healthcare access that Australia government is providing to all their residents. Now, how academically is helping the OPRA exam aspirants. We have curated, we have done a thorough research about the latest change that got introduced, and we have curated the materials in a way so that even if you have a break of 5 years, for say 10 years, in fact, right? So in that case also, you will be having much success. So that is about it. And after that, let me just move to the next slide. The program highlights, we will have instructor-led as well as self-paced content, one-on-one mentoring support, extended course content support, flexible schedule. We do provide the learning facility in the recorded version as well, so you can read it as per your convenience. And once you finish up your examination, placement and visa support is there. Visa assistance is there. Also, we will be thoroughly helping you in terms of your CV writing and cover letter. And this is the update. Give me 1 minute, please. Give me 1 minute. Okay, now this is the updated skill assessment structure that we have already explained you. Okay, now 1 second. Now, why to trust academically? The legacy that we are carrying are, we have delivered so many successful batches for CAPS with 1,000+ positive reviews and 93% success rate. Our faculty profile, all our faculties are highly qualified and they have gone through the similar set of journey. Our course content, which is in line with the exam structure. Alumni network are those who have cleared their examination from Academically, they are already in a group and they are helping the, the recent aspirants for their success, as well as the personalized approach. Whenever there is a requirement, me as a program manager, our entire team is there to help you out. And last but not the least, you can anytime visit our office. And Dr. Akram and team is there to guide you directly. And these are some of the latest bulletins that Academically got presented with. And this is the latest bulletin wherein we got featured on Outlook as well as on Hindustan Times. And the reviews that I was talking about, you all can visit us, search on Google about Academically. You will get to know how we are impacting the learners' journey. Last but not the least, when it is in terms of taking the enrollment, right, there might be some challenges that can happen, but for that we are providing interest-free loan service and EMI option. Advance and Kuhu, they are our official partners, and when you take the enrollment, our team will help you to get the interest-free loan as well as the EMI flexibility. Apart from that, we do provide a scholarship. So those who are really looking forward to join us and competent in their plan, obviously we will help them with some of the waivers so that they can manage their journey accordingly with us. To avail that, you have to visit our website and you have to register for the test. Once you clear up the test, our team will get in touch with you, and based on the score, we will be bagging your scholarship waiver. And these are our social media handles. You can directly follow us on YouTube as well as on the Instagram pages for the latest updates. And this is the contact details. So those who have already shared their details with us, thank you for that. And those who have not yet shared with us, please do the needful. Our team will be in touch with you for the next day. And I think now we can take up the questions. Arina, are you there? Arina? Okay, I have got one question on the chat window. I think this is from IPRA, right? Okay. Need guidance for PhD in Australia. How can I contact you? IPRA, please drop your contact details on the chat window. After that, our study abroad team will get in touch with you and help you with the further details. We will try to help you, with the right information, how much ever is possible from our end. Harish, in order to know the coaching fee, firstly, I would request you that visit our website, that is www.academically.com. Take the scholarship test, okay? And once you fill in that, take the test. Our team will be having your details with us, and they will be reaching out to you with the scholarship waiver, discount, and they can discuss with you in detail. Okay, Nanda is having a question. English proficiency, which one have to take, either academic or general? For all the options, you should go ahead with the academic one. If it is IELTS, PT or OET, go ahead with the academic version. Ram Prabesh, there is a question from Ram Prabesh. What is the difference between the job type according to OPRA and CAPS? There is no difference here. Firstly, this particular examination will just, open up the job door for you. You will be joining there as an intern pharmacist. Once you complete your internship, you will be giving the opportunity to set for the next, exam, which is the intern pharmacist exam. Once you clear that, you will be holding your registration and you can work there as a registered pharmacist. Aisha Marush, what to do if there is no visa invites? It is certainly not the case. There are multiple states who are opening up the visa invites, but you have to just, plan your candidature, and while you're filing for it or applying for the job, you have to plan it accordingly. So your candidature should have all the relevant information, and that should be, be differentiated. Total cost of the examination, for writing the examination, it is 2,190 AUD. CAPS is valid for New Zealand, but the process is a bit different. It is valid for New Zealand too, but now it is like OPRA. Nanda, no, we are going ahead with the academic one only. It is not only about job. You are clearing up one examination, and through that you are going to Australia, right? So the academic one is required here for your English proficiency test. Fill me email, I think that is the username. But if you can just share your details with us, our team can get in touch with you and help you with the tips that you are looking for. Or if there is any specific question, you can let us know. What is the pass percentage of OPRA? This is a very open-ended question. What are you exactly looking for? Harish, to answer your question, for the initial skill assessment, you have to pay 810 AUD. Okay. Once that is done, you will be eligible based on your documents provided. Then you can book your examination by paying the remaining fees. Lalit, again, if you ask about the placement or the job services, it is completely based on your candidature. Abbas, if you're there, you can help me out. You can take a couple of questions.
Yeah, sure, Shwini. Hi.
Ibad, you can unmute yourself and ask your question.
Yes, Ibad, please tell me. Just to answer, Ram Pravesh, industrial experience is valid. All right, so it is actually, there is no any, experience is required for OPRA examination. But just in case, clinical pharmacy experience and retail pharmacy experience will give you an add-ons, right? So it will be more convenient for you to find a job over there.
Hello,
Ibad, please go on. Yeah, please go on.
Sir, I have a question. Like I am a fresher and I have just completed my Bachelor of Pharmacy in 2024. So, will I eligible to work in Australia after clearing of the exam?
Yes, you can work as in, you will be eligible any which way for any of the professionals who want to work as a pharmacist in Australia, right? After completing the B Pharma, you need to clear examination, right? And then you need to clear the English examination. Then you need to, find a job over there, right? So any which ways you are eligible for the sake of that.
Like I have to clear OPRA plus IELTS exam.
Yes. Any which ways.
So you provide both of these two courses.
Yes, we provide. Yes, we provide. I mean, like the steps are very simple. Firstly, you need to clear up with your skill assessment, that is the documentation process, right? Post completion of your documentation, you will be having an option to book an examination slot. Then you can appear for the exam. Once you are done with your exam, then you can appear for English exam. And once you're done with your English, then you will be able to, migrate to Australia after finding a suitable, job for you.
So, sir, how much time it will take to complete all this process?
Depends, actually, depends, honestly speaking. As if I'll be giving you the reference for our curriculums, how we plan it. So we plan it in the structure of 4 plus 4 plus 4, right? So, and in average, it could take a journey of around, I'll say, bare minimum of 9 months on an average.
Like, what is the duration of your course? Like 3 months or
No,
4 months?
We provide the course preparation for 1 year, right? So we have course preparation for 1 year, okay, under which you will be having access for the 4 months of a live class batch, okay?
Okay.
Yeah, and rest
Oh,
will be
like in 4 months, you will complete all the syllabus, like courses, and after that, whatever the process for like PR visa, etc. So you will provide for
I'll
1
tell
year.
you, Ziol, I'll tell you the thing is that this is very detailed discussion, right? So I would really appreciate if you can just drop up your contact details and I'll align a call for you, right? So one of our members from the counseling team will connect with you and will sort your doubts. Like this
Okay,
will be
sir. Okay.
convenient,
No issue.
right?
Okay, sir. Okay.
Please drop your contact details. So someone from our team will get in touch with you, will explain you the entire process step by step and how much duration and everything and how our program works. Okay?
Okay, sir. Okay. Thank you.
Yes, Ibad, please tell me. Yes, Aisha, please go on.
Yeah, hello.
Hi.
So my query is I've passed CAPS exam in November 2023, and I've lodged. I also completed this PT exam, and my score was 84,
Hmm.
and I lodged this UI in December 2024.
Okay.
Then because I have a spouse, even my spouse gave PT exam, so 5 points got added because of that. So now the total score is around 70.
Okay.
Okay, but there are no visa invites yet. So what do you think? What is the point requirement to get the
Hmm.
visas?
I believe it would have been into waiting list or something, right?
Yeah, so how much time is it taking?
Dekho, any which ways you will be eligible, Manu, after, as you mentioned that you already got your 70 points as an PR point, right? So you will be getting option for the PR. Now, waiting list is something which is not, which subject to us. It is something which is with subject to government of Australia itself, right?
Yeah, yeah,
In,
yeah, yeah.
this platform, I would not be the right person to, give you any commitment on the sake of saying. So I
Yeah,
believe you can wait for some time. And just in case if you didn't find it well, so you can move ahead for the other options as well. I mean, like you can go on study visa itself. I mean, like this could be an
yeah,
option just in case if
yeah,
you.
yeah. See, I understand that you cannot give me the exact and accurate answer for my question, but the thing is, I've been waiting for an year still now. Okay, so I just wanted an approximate answer, like how much time will it get for me to get the visa? Like approximately, not exactly.
So are you applying
According
for
to what you
jobs or
know.
something?
Sorry?
Are you applying for jobs or something like that?
No, I did not start applying for jobs. I was actually waiting for this PR visa thing.
I believe you should part time also apply for jobs and all, right? Because I believe this would be increasing your chance for getting a sponsor visa over there, and then it will be much more convenient for you to get PR.
But I think job opportunities, they're only hiring experienced people, no?
Not as such. I mean, like, there is no as such criteria for the sake of same. But the thing is that any which ways, it is on the basis of the category that you will be taking it forward for, right? So just in case if you want to, migrate to Australia, irrespective of the zones, I mean, like, let's suppose if you want to move only to the tier 1 countries, then to work in remote organization, remote areas, then that might be a constraint. But just in case if you're open to work for remote areas as well, then it could be a good options for you as well, right? So
Yeah,
it is,
yeah. Currently, I'm not in Australia, so I'm open to any state.
I believe, sponsor visa could be an option or study visa could be an option. I mean, like answering to the queries of yours, right?
Yeah, yeah. But the thing is, again, study visa will require too much of investment, right? Around
Hmm.
some lakh.
Yes, it will require somewhat of the investment, but the thing is that it will give you, another way of clarity. I mean, like it will be giving you, very different way. I mean, like you can do one thing, you can actually drop this. I mean, like one of the counseling team members can actually get in touch with you and give you a quick clarity on the sake of same, right? How visa for the study students can work.
Yeah, yeah. Even the counseling team, I contacted them. I'm
Mm-hmm.
connected to them, but they said that only study visa is the only option, in their opinion.
No worries. If that is the case, then I mean, like it could be a bit elaborative thing for you. I mean, like how study visa could be convenient and what will the possible ways out. So we can even give you assistance on that as well. So it will be really great. Aisha, if you can drop your contact details, then I'll actually check with the counselors, and then our team will get in touch with you and give you the more clarity on the sake of saying.
Okay. Thank you.
Okay. Yes, Peter, please go on. Am I audible, Peter?
Okay, yeah. Good afternoon. Can you hear me, please?
Yeah, hi.
Okay. Good afternoon. All right. I'm Peter Shirak. I am calling from Nigeria. I didn't miss the beginning of this webinar, although I checked my reminder, but I think the time difference in a way. So I have some few concerns actually, and one of my concerns is there a way that academically can help create a kind of network between international pharmacists in Australia and international pharmacists generally, those who are trying to move into Australia via CAPS and OPRA, such in a way that we can have like something like a one-on-one mentorship that will help us in easy transitioning to Australia, especially in terms of the job search, giving us hints aside searching for jobs on Seek, Indeed, and all of those places. I think if it's possible, and it will be very, very good for a lot of international pharmacists that are trying to move to Australia to have that kind of network that we could relate, we can find mentors and speak to people. I've messaged quite a number of people on LinkedIn, but nobody has replied. A lot of pharmacists who are practicing in Australia, like international pharmacists, but a quite number of them have not replied. So I don't know if academically can help bridge the gap of that communication and that can easily hasten the transition of international pharmacists. So, and also I sent a message through the academically website for inquiries about the OPRA preparation course and some other
Yeah, go on.
academically, but I've not received any response. Yeah.
Okay.
No, thank
All
you. So
right,
those are my
Peter.
questions and my concerns.
Right. I really appreciate the feedback that you have recently given, right? Surely. But the thing is, I'll give you better clarity, Peter. The thing is that we are an organization who are more focused, or I'll say who are, working for helping the professionals to prepare for their licensing examinations, right? So, any which ways, talking up to the concern that you are having, right, regarding the queries and concerns that you have raised for the exam preparation courses details for OPRA. So you can do one thing, you can actually drop your contact details right away into the chat box, and I'll assign someone from our team, right, who will call you on the immediate basis and will synchronize as per your time zone, right? So that all the clarities and all the concerns could be solved in your quizzes.
Okay, all right. Thank you very much.
Okay. Have a good day. Ibad, I think, am I audible to you? Shoini, am I audible?
You are Abbas.
Okay.
I think I got his question on the chat window. He is mentioning that, sir, I'm a student of 5th of pharmacy, am I eligible to sit for the OPRA test? You are, like, once you are completing your degree, right? You will be able to sit for the examination. There is no problem in that.
All right. Any more questions and concerns? I mean, like, guys, if you have any questions, so you can, get in touch with us. Just in case if you have any queries and concerns that you want to ask, you can ask us right away. Else, you can drop your contact details and the counseling team will get in touch with you. Yes, Nadir, please tell me.
Sir, actually, I applied my registration certificate in Bihar government. Till now, I did not get. So, am I eligible for this exam?
No,
Clear registration certificate till now.
See, Nadir, you need to have your registration certificate as a pharmacist of your home country, right? So before that, you can't, actually go forward for any of the process of skill assessment. I mean, like, your documentation process won't be the, moving ahead for the sake of same, right? You need to have your registration certificate. So this is something which is a must requirement for any of the individual who wants to work as a pharmacist in overseas, right? To have their registration in their home country first.
Among this, they given a slip. They said that after 2 years, you will able to get a registration certificate. Because Bihar government, it takes too much time. That's why I'm saying.
So you are from which state, Nadir?
Bihar.
Bihar. Okay. I believe this wouldn't be an exception because, for Australian councils, this is something, they don't consider it, India into a separate state-wise considerations. They take it, a national certificate, a national registration requires, is required for filing for the skill assessment, right? So any which ways you can do one thing.
Or else, sir, I can apply. Sir?
You can do one thing. You can drop your details, right? And one of our members will get in touch with you.
Already I dropped, sir.
Yeah, we'll get in touch with you. We'll understand your profile and we'll be able to guide you into a better phase. Like, this is something which is a better technical discussion that is needed to be happening.
Okay, thank you, sir.
Okay, have a good day. Yes, guys, anyone else? All right. So I believe, all of the participants, thank you so much for joining us, right? And you can do one thing. You can actually drop your details just in case you have any queries and concerns. And our team will get in touch with you shortly and will address all your concerns. Just in case if anyone have any queries, this could be the right time for you to ask. Else we can get in touch with you later. Over to you, Shwani.
Thank you, Abbas. Guys, please feel free to drop your information so that we can get in touch with you after the webinar. Peter, we have received your contact details. We will be in touch with you. Thank you so much, guys, for joining us today. And we will be giving you a call by earliest tomorrow. And we will help you out with your queries. Thank you so much.
Yes, 𝗙𝗥𝗘𝗘, you can take the last question. Please go on.
Hi, sir. This is Ram Kumar, practicing as a pharmacist in South Africa. More than 20 years of experience in public service as a hospital pharmacist. But I'm just 49 years old. So I would like to write the OPRA exam, and I did get the assessment, like a confirmation of assessment, but I don't want to appear the exam in this March. I would like to prepare for the July exam. My question is I knew that like a 49 years old is not eligible for
Yeah.
like residency, yeah, permanent
Yes.
residency program.
Mhm.
So what are the other options I can opt, like a work visa or any other kind of visas? Please assist.
Work visa could be a good option for you. I mean, like work visa is something a good option for you, right? Because that is,
Yeah.
I believe, not a good option. I said that will be a more convenient option for you, right?
All
Rest
right.
PR is something which is, in Australia, that the age limit for the PR is somewhat around 45, right? So PR won't be the, I would say, not the right thing for you to move ahead. But any which ways, you have another options as well. I mean, like, are you in touch with someone from our team?
Not yet. I did WhatsApp on, I think on the number, but I did not get any response. But I don't know what was the problem. So was the right number, or I don't know.
One thing,
Did I contact the right number
you
or
do one thing.
something?
You can do one thing. You can actually drop your contact detail into the chat box right away, right? And I'll assign a
Oh,
counselor for you on the immediate basis, right? So they
all
can
right.
explain you the visa processes and how options could be for you, right? As in for you with the experience, because you have a very wonderful experience, right? So what could be the best options
Yes.
for
Yes.
you? This could be something which could be addressed into a complete way.
Yeah, sure, sure. Sure. Another thing, so the work visa can be extendable, right? Even for, I think it's limited for 4 years. It is
Mhm.
extendable, right?
Right. Absolutely.
Okay, that's a great thing. So yeah, let me drop my number on this chat group. Um, then yeah, otherwise you can tell me the number which I can contact. I can write
Uh,
it down now.
it'll be more convenient for you to drop us our contact number, so that I can assign a counselor right away. I mean, like,
Oh, okay. So can I? Shall I drop the number now? Yeah, on this
Mhm.
number. I mean, on this chart.
Yeah, on this chat, you can drop it.
All right. Okay. Thank you, so. Have a good one.
Okay, have a good day.
Thanks. Bye.
Bye. All right. Yes, Harish, please tell me.
Yeah, so already Aisha said that she is not able to get a visa, so she was passed the CAPS exam. And what would be the reason if I also give an attempt and I to pass the exam, I have cleared my English test, and
Mhm.
what will be the like her if I also face the same issue means so what I can do for that?
See,
Why
any
she
which
is
way,
facing like that?
I'll be telling you one simple thing. The thing is that, for migrating to, any of the foreign countries, when you are not going on, firstly, she was applying for PR, right? And secondly, just in case if you directly don't want to apply for PR, you can start looking for the jobs as well, right? So you can have an option for sponsor visa as well. Just in case if you don't go forward for jobs, you want to do for, a
Yeah,
sponsor thing, then you can apply for, uh, I'll say, study visa. So there are multiple options for any of the things.
No, wait. For study visa, I need to pay. I need to pay, and I need to study for 30 lakhs. Not there. I need to
Mhm.
pay for that. I'm right.
Yes, but any which way you will be eligible to work as a pharmacist, na? Over there.
Yeah, yeah. I have
You
been eligible. Oh, you are saying that you need to apply for the study visa, then you need to go in. Afterwards, you need to search for the pharmacy exam, like that. You are saying, right?
right.
Okay. Okay.
There are possibilities. There are many possibilities. I mean, like, there could be this is actually a vast discussion about the profilings, right? So just in case,
Mm-hmm.
are you connected with someone from our team, Harish?
No, I'm not.
All right. So you can do one thing. You can drop your contact details, right? And someone
Yeah,
from
I've already dropped.
Okay, wonderful. Then somebody from our team will actually get in touch with you, right? And we can tell you about the possible, scopes for visas and possible scopes for, how you can move ahead. I mean, like, this is a journey, right? A situation of the journey. I mean, like, if you can take ref, you can go to this pathway. You can take right, you can go to that pathway. So it is totally
Yeah,
different.
that I'm totally agreeing with you. So the both the thing we are investing and we need to pay for that exam and we are passing, and then then the visa is not there. We need to go for a study visa. Then only we can afford it. In the sense, it's not sounds good, no. For
But any which ways, this is the visa is something which is not with the,
yeah,
I'll say,
that I know. That's not with the academically part.
right,
That's
right,
purely based on the US, Australian government part.
right, right.
But the thing I'm asking is like this also there are chances are being there. So I'm
Even
now clear with that.
if you get visas, that is something which is something, a different discussion. Any which ways, you can,
Okay, okay.
wait for that.
And last question for you.
Thank you.
Whether if I'm having an industry experience over 5 years, it's in such case I'm not having, such case I have 5 years in the sense whether though I am clearing the OPRA and
Hmm.
whether I can work as an industrial like QA or QC in industries in Australia with this
I'll
OPRA
tell you.
passing test.
No, I'll
No.
tell you one thing. The thing
Mm-hmm.
is that for any of the individual who wants to, work as a pharmacist, right?
Mm-hmm.
Now, a simple example of being a pharmacist is that any of the individual who can, work as clinical pharmacist or hospital pharmacist or retail pharmacy, right? And, can prescribe medicine or can provide medicines and all. That is something which is with to opera. Talking about the industrial part, right? Although it is really good, you have an experience. I respect your experience, right? But the thing is, it won't be giving you any add-ons, right?
Okay.
Yeah, because this is something with respect to the pharmacist.
That I completely agree.
Yeah.
If in such case I'm asking in such case I need to work as an industrial like QC, then there's a chance to work there over Australia, or that's an employer thing. Here the company needs to go on site for me, or else
Mm,
I can get a job over there as this experience is valid for me.
Industrial or scope for industrial pharmacists is very low, right?
Okay.
I'll be very honest with you. Scope for as an industrial pharmacist is very low in Australia, but
Mm-hmm.
there is all never say never. So I
Mm-hmm.
believe there's always an opportunity where you can actually have a try for the sake of saying. So, but scope is low.
Okay.
I'll be honest, scope is low.
Scope is low. Okay. Okay.
Okay.
Okay. But thanks.
All right. Okay. So I believe we have already answered all the queries, right? And just in case if any of the queries being left unanswered, right? So our team will be getting in touch with you guys shortly, right? You can just wait for the calls and they will assist you in all the queries and concerns for you guys, right? So I think, Shwini, we can end this call, I believe. All right. Thank you, guys. Thank you so much for joining. Have a good day.
Okay, sir. Thank you.